Hi, my name's Jill Blevins. I'll be your nurse practitioner for your assessment today. I've already washed my hands, so we've done that part of the assessment or the video. Do you feel warm right now? Are you comfortable now?
I'm
Okay.
comfortable.
Can you tell me your name and age, please?
My name's Megan. I'm 26 years old.
Okay. And what brings you in today?
I've been having some abdominal pain.
Abdominal pain? Okay. What does it feel like? Is it throbbing, aching?
It's a sharp pain in my lower abdomen that came on yesterday afternoon.
Okay. And it's been just going on since then, nothing before that?
No.
Okay. And does anything make it worse?
Eating food makes it worse.
Eating food, not moving, or anything like that? No. Okay. Does anything make it better?
No.
And what would you rate it? Scale from 0 to 10.
Probably a 7.
A 7? Okay. And you have any vomiting? Any vomiting?
I've been vomiting.
How many times have you vomited?
Probably 7 or 8 times.
7 or 8 times. And the character of your emesis, is it dark? Is it undigested food? Is it bloody?
Well, I haven't been able to eat a whole lot of food, and so it's more greenish in nature now.
Okay. And what about bowel movements? Have you been able to have bowel movements? You have? When was your last bowel movement?
Yesterday.
And was it diarrhea or was it?
It was normal.
Normal? Okay. Fever?
I do feel like I've had a fever.
You do? Okay. Any other symptoms? Headaches? Do you feel like
Well, I had some chills, but no other, just the abdominal pain and some chills.
And no radiation to the chest, to the back, anything like that?
No.
And no trouble urinating or other than that?
No.
Okay. All right. Do you take any medications?
No medications.
Okay. And are you allergic to any food or drugs?
No.
No? Okay. What about, have you had any traumatic events in your life, any accidents, anything like that? And do you take any alcohol or drugs or any other kind of
I don't drink
tobacco or anything like that?
No.
Okay. Do you see your physician regularly for pap smears?
Usually every once a year, yes.
Okay. And you have normal periods? Okay. And do you have a family history of any kind of cardiac or any kind of cancer, any autoimmune diseases?
No
like
cardiac history. My mother has had some skin cancers. My father had some kidney stones, but other than that, no.
Okay. And as far as review of systems, I'm just going to go from head to toe.
Okay.
Today I'm going to look at you, everything. So I'm just going to ask you some general questions about everything. Do you have any kind of headaches, tremors, seizures, blurred vision, double vision, eye pain, ear pain, difficulty hearing, ringing of the ears, any discharge from the eyes, ears, or nose?
No.
Trouble breathing through your nose?
No.
Any trouble breathing, period?
No.
Any sore throat, trouble swallowing, any dental problems?
No.
Chest pain, shortness of breath, cough?
No.
No? Okay, what about, other than your abdominal pain, are you having any kind of back pain?
No back pain.
No back pain?
No.
Okay. Any kind of musculoskeletal problems, any kind of arthritis, any tenderness, swelling, edema?
No.
Anything like that?
No.
Any kind of bony deformities or anything? As far as genitourinary, you're voiding okay? No burning, no
burning.
hesitancy, frequency, anything like that?
Nope.
Okay, and you said you have normal periods. Do you practice self-breast exams? Okay, good. I want to start off, if you feel like it, and we're just going to do a quick eye exam.
Okay.
And I'm going to have you step over here to the Snellen chart.
Okay.
And I'm going to have you cover your right eye, and we'll assess your left. And I want you to read down until you can't read anymore. Or
Okay.
until I tell you you miss one.
EFPTOZLPED PECFD EDFCZF.
Okay, you're 20/30 in that eye.
Okay.
Can you tell me that color?
Green. You want me to keep my eye covered?
Yeah.
Red.
Okay, and now do the other eye. And we'll assess your right eye.
Okay. EFPTOZLPED PECFD EDFCZF FEL.
Okay, you're 20/30 in that eye.
Okay.
I'm sorry. And then this is,
Green
okay,
and red.
okay, good. And that tests cranial nerve number 2.
Okay.
And I'll have you come over here and sit down, and I'll do the external eye exam and some visual acuity testing. Okay. Looking at your external features of your eyes, They're symmetrical, appropriate blink response, your sclera is white, your cornea is clear, lashes are equally dispersed. I don't see any discharge. Do you have any eye pain? When I touch your eyes, conjunctivitis pink. Okay, and I'm just going to do a visual acuity test, okay? As far as to test for your any extraocular movements, and this is testing cranial nerve number 3, 4, and 6. So just follow my pen, okay? Good. 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 Okay. I'm gonna ask you to look at this and then focus on an object far away.
Okay.
Okay. Good. Good pupillary response. I'm going to dim the lights and I'm going to do a fundoscopic exam, okay?
Okay.
Alrighty, just look straight ahead for me. And I'm looking for your pupil reaction to light. Good. Good. Okay. And now I'm going to do the red reflex check. The red reflex, and now I'm just going to look into your eye. Retina is pink. I'm not seeing any hemorrhaging, any discoloration. Optic disc is yellow and round. I'm not seeing any hemorrhaging. Vasculature is appropriate. Okay. Okay. Red reflex is present. Optic disc is yellow and round. Retina is pink. I'm not seeing any obvious hemorrhage or any hemorrhaging or any abnormal pulsations. Good, the plaques. Okay, and now I'm just going to do a couple of tests on your ears. I'm going to look at the external of your ear. I'm going to look at the inside of your ear, and I'm going to do some hearing tests, okay?
Okay.
I'll do the hearing test first. The tuning fork is missing. Let me grab it really fast. The tuning fork, what I'm going to do is I'm going to just strike it with my hand and I'm going to put it here and you tell me if you can hear it in both ears or one or the other more, okay?
Okay.
And this is called the Weber test.
Hear it in both.
Good. Okay. And now I'm going to assess for bony to air conduction to see if that's appropriate. So I'm going to put this on your mastoid and then I'm going to hold it in front of your ear. You tell me when you stop hearing it, okay?
Okay. Okay. Okay.
Okay. And that's a 2-to-1 ratio. Normally you hear it longer in the air than on the bone.
Okay. Okay.
Okay, good. Now I'm going to do the whisper test. I'm going to occlude this ear and I'm going to whisper a word. You repeat after me, okay? Basketball.
Basketball.
Okay, good.
Piano.
Good. All right. Now I'm just going to look at the external of your ear. And the peanut is nice and soft. No lesions, no scaling or anything, no edema, no discharge noted on either side. Okay, and now I'm going to look at the inside of your ear. This says for any discharge, any erythema. Sorry. Okay, tympanic membrane is pearly gray. I can see the malleus. I see no discharge. Hair is equally dispersed. No bulging, no perforation, no erythema. Good. Ear canal is clear. Hair is equally dispersed. I see no edema, no discharge. Tympanic membrane is pearly gray. Malleus is visible. No perforation, bulging, or erythema. Sorry.
It's okay.
Okay. And now I'm going to test cranial nerve number 5. I'm just going to palpate your TMJ joint, okay?
Okay.
Your temporomandibular joint. And you tell me if you have any pain. Open and close. Good. No crepitus, no abnormal bony structure, no swelling, no pain.
No pain.
Okay. I am going to test cranial nerve number 5, and you close your eyes and you tell me when you feel this wisp your face, okay?
Okay. 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 Okay.
Good. And I'm going to test cranial nerve number 7, and I want you to blow out your jaws. Okay, good. And I want you to raise your eyebrows, close your eyes, squint your eyes. Okay, good. It's intact. And I'm going to look into your oropharynx and your nares. I'm going to assess for any kind of swelling, any exudates, or anything like that.
Okay.
Looking at your external nose, I don't see any deviation. I don't see any lesions, any swelling, or anything. I'm just going to look up inside. If you can hold your head back for me. Okay. Inferior turbinates visible, no edema. Pink and moist. I don't see any polyps or anything. Keep this. Okay. No abnormal discharge or anything. And I want you to open your mouth for me. I'm just looking at the mucosa. I'm looking at the soft palate, hard palate, buccal mucosa, the tongue, the teeth. I'm assessing for any kind of dental problems in the throat. Go ah.
Ah.
Okay, tonsils are +1. No erythema, no exudate, no swelling. Testing cranial nerve 9 and 10. I'm going to test your gag reflex. And I'll stick right here, I'm sorry. Oh. Sorry.
It's okay.
Okay. And when you said you're deviated from the midline, your soft palate raised appropriately. Are you okay?
Uh-huh. Yes.
I see no exudates, no lesions, no kind of blisters or discoloration or swelling in your mouth or your throat. Now I'm going to check your lymph nodes.
Okay.
I'm going to check your preauricular and postauricular and your occipital, your submandibular, submental, tonsillar, posterior cervical, anterior cervical, supraclavicular, and infraclavicular. I'm not feeling any edema, any swelling, any nodules, any kind of warmth or anything like that. I need for you to test cranial nerve number 11.
Mm-hmm.
I need you to raise your shoulders against resistance, okay, and then push your head against. Good. And I'm going to palpate the trachea. It's midline. I'm not feeling any nodules. I'm going to palpate your thyroid, okay?
Okay.
Okay. Swallow for me. Okay. Thyroid is raised appropriately with swallowing. No nodules. It's smooth. Left lobe. Swallow for me. Good. It rises with swallowing. No nodules on the left lobe. Okay. Now I'm going to have you stick your tongue out at me. Okay. That tests cranial nerve number 12, and speech is appropriate. Tongue is midline, so that is intact. And now I am going to perform the cardiothoracic assessment, and I'm going to start by inspecting the chest. And I'm just looking for any abnormal pulsations, any abnormal bony prominences, any discoloration, or any asymmetry with breathing or flail chest. And I'm assessing for barrel chest, which she does not have. Her lateral to AP diameter is 1 to 2, or maybe lateral's a little larger. And I'm seeing no discolorations, and I'm going to percuss over the lung fields to listen to see if you're fine. For resonance, which is the normal finding. That's what we're finding. Okay, and I'm going to ask you, I'm going to put your hands on my hands on your back, and I want you to take a deep breath in. Good. Nice and symmetric. My hands moved the same distance away. And I'm just going to palpate the chest for any kind of masses, swelling, edema, bony prominences. Sorry, I didn't mean to tickle you.
That's okay.
Good. Okay, and now I'm going to auscultate the lung fields. Okay, listen for any kind of crackles or any kind of wheezing or diminished sounds. Take a deep breath. Good. Good. Deep breath. Good. 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 And I'm going to ask you to say E.
E.
Okay.
E.
Good. And it sounds like all, which is a normal finding. I didn't hear any crackles, any wheezing, any kind of diminished breath sounds. As far as your cardiac assessment, I've already inspected your chest. I've already palpated. I didn't feel any kind of abnormal pulsations, any heaves, any masses, anything like that, any asymmetry with movement. So I'm going to have you lie back.
Okay.
And I'm going to listen to your chest. And I'm going to listen over the pulmonic, aortic, and mitral and tricuspid valves for any abnormal heart sounds. And I'm going to listen for your pulse for a minute, okay? For the pulmonic, aortic, tricuspid, apical pulse. I'm going to listen for a minute. Okay, your pulse is 62. I'm going to listen to your carotids, okay, with the bell for any bruise. Any bruise. Good. I didn't hear any abnormal heart sounds, no S3, S4, no murmurs, gallops, or rubs. I'm just going to palpate your carotid pulse, okay? And no jugular venous distension noted. I can see the carotid pulse. She's lying flat. I'm going to palpate the radial pulses. And they're +2. +3, I'm sorry, +3. I'm going to palpate the femoral pulses. +2. And the popliteal. Now I'm going to palpate the dorsalis pedis and posterior tibial. And I'm assessing for the presence of any edema, which she has none. Pretibial and ankle. Extremities are warm and pink. Capri feels less than 3 seconds.
Sorry, I'm ticklish.
Less than 3 seconds.
Okay.
Okay. I'm going to have you stay lying down.
Okay.
I'm going to, actually I don't need this yet. I'm going to perform your abdominal assessment since you're having these symptoms.
Okay.
I'm just going to look at the contour of your abdomen, which it's flat. I don't see any abnormal pulsations. You're fine. Abnormal pulsations. I don't see any obvious masses, discoloration, or anything like that. I don't see any swelling. It doesn't look like you have any signs of ascites or anything, or organomegaly. I'm going to auscultate, and I'm going to listen in all 4 of your quadrants and over your aorta, iliac, renal, and femoral arteries, okay?
Okay.
Try to make that warm. Your bowel sounds are there, but they're a little hypoactive. Does it hurt for me to just listen?
I can feel it. No, I can feel it, but it doesn't hurt.
Okay. Listen over the aorta. Not hearing any murmurs in the iliac arteries. I mean the renal arteries. Iliac arteries. And the femoral arteries. No murmurs. And now I'm just gonna percuss over your abdomen, okay? And tell me if this is too uncomfortable, okay? Tickle your tympani. Okay, good. I'm gonna percuss over your liver, okay?
Okay.
Just assessing the size of the liver. I'm gonna percuss up till I hit dullness. Mark on your belly, okay?
Okay.
Okay. And now I'm gonna percuss down. Measure. You're 7 centimeters, which is a normal finding. Okay, your tympani in all 4 quadrants. I'm now going to palpate. I'm just going to lightly palpate. You tell me if you feel pain, okay?
Okay. I feel a little pain in the right.
Right, okay. All right, tell me if this hurts.
Yes.
Okay. And then I'm going to hook my fingers up into your ribs.
Okay.
You tell me. You tell, or take a deep breath and tell me if it hurts, okay?
No.
Okay, good. All right, and I'm just going to feel for your liver and any kind of enlargement. I need you to take a deep breath. Okay, good. I don't feel any organ enlargement.
Okay.
I'm sorry. And then
It's okay.
renal. No. Deep breath. Okay. And another deep breath. Sorry if that's uncomfortable.
It's okay.
I'm not feeling any organomegaly or anything like that.
Okay.
You do have tight abs though, I'll have to say. Okay, I'm gonna do a couple more tests since you're having abdominal pain
Okay.
to check for any other findings. So what I'm gonna do is I'm gonna have you raise your leg, okay, and push against my hand while I push down. Just hold this leg up and then push against my hand. Does that hurt?
Yes.
Okay, try this. Does that hurt?
Yes.
Okay, and I'm just going to bend your leg, and I'm going to go in and out. That's the obturator sign. Does that hurt?
A little bit.
Okay. Does that hurt?
A little bit.
Okay. Alrighty. So it looks like you're having some significant abdominal pain, which I'm concerned about. So I'm going to hurry up and carry on with the exam, and then I'm probably going to send you to the ER, so
Okay.
don't freak out on me.
Okay.
But I just want to get this checked, okay? So I'm going to have you set up for me, and I'm just going to kind of hit my hand on your back to check for any tenderness here, okay? And tell
Okay.
me if it hurts.
No.
Okay, good. All right. Now I'm going to do a musculoskeletal exam, a
Okay.
really quick one, and I'm just going to check all your joints and make sure that you don't have any kind of deformities or swelling or anything like that.
Okay.
So I'm going to first check your neck. I want you to turn your head side to side and up and down. Okay, and round and round. And no pain, right?
No pain.
No pain. Okay, down it. Okay, good. Okay. All right. And your shoulders, I'm just going to palpate as you move in different directions
Okay.
for me. I'm going to ask you to flex your shoulders toward me. Good. And raise your arms. Okay, good. And put your arms up. Good. Okay, and put your arms behind you. And now behind your back. Okay, good. Good. I don't feel any deformity or any abnormal bony prominences, any edema. That didn't hurt, did it?
No.
Okay. And I'm going to ask you to hold your arms out. I'm going to ask you to turn your hands up and down, supinate, pronate. Good. I'm going to ask you to bend your elbows and extend your elbows. Good. Doesn't feel anything abnormal there. Your wrists, I'm going to ask you to flex and extend. Yeah, it's fine. I don't feel any abnormalities there. And I'm going to ask you to ulnar deviate and radial go in and out. Good. Okay, and your fingers, I'm going to ask you to extend and flex. Okay, bend your fingers for me. And adduct and abduct. Okay, good. Good. I don't feel any abnormalities there. Okay. I'm going to ask you to lay back one more time. I know
Okay.
it's uncomfortable for
It's
you.
okay.
And I'm going to ask you to raise your hip. Okay, and extend your hip. Good. Flex that hip and extend. Good. And adduct your hip in and abduct out. Good. Adduct in, abduct out. Good. All right, I don't feel any abnormal joint movement there. And your knees, I'm gonna ask you to flex and extend. Good. Feel any abnormalities? Flex and extend. Good. No abnormalities, no swelling, no edema. And your ankles, I'm going to ask you to flex and extend. And there you go. Invert and evert. Out and in. Good. No abnormalities. Your toes, I'm going to ask you to flex and extend.
Okay.
Okay, I don't feel any crepitus or anything. I haven't felt any crepitus in any of your joints. Okay, I'm going to ask you to stand up now, and I want to just look at your back really fast. Okay, I'm just going to palpate your spine. It's nice and midline. I'm not feeling any abnormal bony prominences, no swelling, no edema. Is it tender?
No.
Okay, and I want to ask you to bend over for me. Good. Nice and midline. No abnormalities. Okay. I'm going to ask you to lateral bend from side to side. Okay. Good. Okay, and no pain with that.
No.
Okay. And I'm going to ask you, I'm going to perform a neurological exam really quick on you. So while you're standing, I'm not going to make you make any unnecessary movements. I'm just going to ask you to just stand with your eyes closed, and I'm just checking your balance and equilibrium, and I'm not seeing any kind of swaying or anything like that. And I'm going to ask you to do a one knee bend test,
Okay.
one leg knee bend test. Good, good. And now do the other one. Good, nice balance. I'm now going to check your deep tendon reflexes.
Okay.
And
Do
I'm
we
just-
sit
yeah.
down? Okay.
I'm just gonna check those really quick for you. Okay, I'm gonna check your triceps. Show like your arm for me. Okay, +2. And your biceps. Okay, +2 is the normal finding. Biceps +2. And triceps +2, normal finding. And patellar +2, +2. And now we do the ankle. +2, +2. Okay, and I'm going to ask you to squeeze my hands for strength. Good. Good strength. +5. And push against my hands. Good. +5. And I'm just going to do, I'm sorry, +4. And I'm going to do a sensation test on you. Just,
Okay.
You tell me the difference between soft and sharp, okay?
Okay.
All right, close your eyes for me. Sharp, okay? Soft. 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 Sharp, okay? Sharp. Sharp. Soft. Sharp. Okay? Sharp. Sharp. Soft. Soft, good. Okay, pass that. Looks like neurologically you're intact. What I'm going to do is probably send you to the ER because you're running temps, having this vomiting, and your belly don't sound good and your pain. So that concludes our assessment, and everything else looks normal. So I appreciate you coming in today.
Okay, thank you very much.